everybody. A warm welcome to tonight's Cavernoma Alliance UK webinar. Tonight, we're going to be talking about misdiagnosis and surgical uncertainty, a patient's perspective. So without further ado, I'd love to introduce our panelists for tonight. So let me begin with Iman Muzafar. Imam, do you want to wave to say hello? There we go. So Imam is a fifth-year medical student at King's College London. She has an interest in neurology, and the reason we got to know Imam was because she was a runner-up in the very prestigious Student Voice Prize competition. So for those who don't know, we're going to hear more about this. That is a global competition with all the top universities, Harvard, everywhere you can think of, and to come a runner-up was, extremely amazing. And Iman wrote her essay on Cavernoma, which is why she is joining today. And that was actually published in Springer Nature in their blog, which reaches quite literally millions of professionals. So an amazing way to raise awareness about our condition. So next is Charlotte Cuffe. Charlotte, do you want to give us a wave? Hi, Charlotte. So Charlotte is a long-standing member of Cavernoma Alliance UK. And as you're going to hear today, Charlotte has lived experience herself as a Cavernoma patient. Not only that, Charlotte is studying a PhD in genetics and genomics in equines, and is also a member of our advisory board as a patient representative. And last but not least, let me introduce Dr. Helen McManus. Hi, Helen. Do you want to give us a wave? Hello. So Helen is Training Program Manager at Medics for Rare Diseases. And the reason why Helen is here today is because she leads their coordination on the Student Voice Prize. And so she will be telling us a bit about that before we hear from Iman and Charlotte. So I'm going to hand over to you, Helen. Do you want to kick this off by telling us what is the Student Voice Prize? And for anybody on today's webinar who's interested in getting involved, how do they do that?
Absolutely. Yeah, what a pleasure to kick things off. Thank you so much for having me along. It's great to be with everybody this evening. And thank you, of course, to Charlotte and Iman for collaborating so beautifully on the essay focusing on Cavernoma. I think together you really shone such a light on some of those challenges that we hear about all too often amongst people with lived experience of rare conditions. But I'm here, of course, to tell you a little bit about the Student Voice Prize, which is how you two were introduced. And the Student Voice Prize is our international essay competition for healthcare professional and life science students. We run it in partnership with Beacon, another rare disease charity you might be familiar with, thanks to some sponsorship from a medical communications agency called Emotive. And we think that the Student Voice Prize is unique in that it gives people who do have lived experience of rare conditions the chance to educate and inform our student authors by sharing their experiences through an online interview. And every year we have a different theme for our questions. So this year, the essay questions are going to be along the lines of the experiences of children and young people affected by rare conditions. So if you have lived experience of a rare condition or you're a patient advocate, what we call the patient pairing scheme is already open, and you'll find a link to join up on the Student Voice Prize website. And if you know or you are a student that would like to take part as an author, the pairing scheme opens on the 2nd of October. But I certainly won't take up any more time this evening. Thank you for letting me share some information about the competition. And I'm really looking forward to hearing a bit more about your experiences, Charlotte and Iman, of working together.
Oh, thank you so much, Helen. And hopefully you'll get some people getting in touch with you. So just to let you know, we're now going to begin by chatting with Charlotte and Iman about their experience. So Charlotte, I'm going to start with you. So thank you so much for joining us. And we really appreciate you sharing your story because we're conscious that's not always easy. So going right back to the beginning, could you tell us about the first time you suspected something what wasn't quite right? What was happening in your life and what symptoms were you getting?
Yeah, of course. So at the time I was doing my final year of my undergrad, and I just sat my Christmas exams. I'd had a bit of like a flu or something because it's exam season, and I had this weird numbness in my face that wouldn't disappear. Um, but I'd had it like 2 years beforehand, and my GP had said it was because of an ear infection. So I kind of just waited all month for this ear infection to clear and this weird facial numbness to disappear. And when it was reaching the point of, I was like, okay, it hasn't cleared yet. I'm going to go talk to my GP. So I went to the university's GP, and I kind of said, I've got this thing. It's happened like a year and a half ago. And my GP then thought it was maybe an ear infection, but nothing is cleared up. She was then a little bit more concerned and was like, she wanted to refer me to neuro, so I sent off that referral fairly quickly. And then I left the office, went off to go about my like Christmas preparations when I get a phone call again from this GP going, hi, I'd actually really like you to go to A&E. Just to rule out, because I had a month-long trip to the US planned, just to rule out anything really simple that could be causing the numbness and anything like more severe that needed to be looked at, say, before I went to the US. So I went to A&E, went for that appointment. And while I was there, the registrar agreed with the GP and again talked to the neurologist in the group and brought me to sent me a referral for the neurologist for like 3 weeks later, which if anyone knows the Irish health system, when it moves that quickly, it's kind of scary. And I got referred for my first MRI, which I had within about 2 days coming back from my appointment, from my trip. And in that MRI, like the letter sent off, they were querying whether it was MS because it was these two repeated kind of neurological episodes that they were, yeah.
Charlotte, that must have been incredibly hard to have seen that was what they were exploring, and not having that certainty and having to wait on the MRI. And do you mind telling us what then happened when you went and had your MRI?
So I had my MRI, and then again, it moved way too quickly. I think about 2 days later, I had my first appointment with my neurologist. And with that, at the appointment, I remember going into it and going, I'm so nervous. They're just going to say there's nothing there. There's no reason for me to feel the way I'm feeling. That it's just anxiety, it was just anxiety from the exams or stress, or I've, yeah, like caused it to myself basically. That I went in, and then there's also the question of the MS still sitting in the back of my brain of going, well, that's a pretty life-changing diagnosis then. And so when I went in and was told, oh yeah, there's something there. They couldn't tell what because it wasn't without contrast. It was without contrast, so they just could tell that it was a lesion of some sort. I actually felt really relieved because I was like, I'm not crazy. There's actually a reason for why I'm feeling the way I'm feeling. And then afterwards, I went to Dr. Google, as you do, and looked up, well, what could this lesion be? And I mean, one of the first things that flags up before Cavernoma is an AVM, and I was like, well, that doesn't sound great either. So then had another appointment a couple of months later after I had an MRI with a contrast, where they again were still considering that it was an AVM and had sent off a referral to the neurosurgeon as well. So that appointment was due a few months after that.
I mean, Charlotte, what a roller coaster of emotions. So you say you're thinking, could it be MS? And then you're told, probably not, it's an AVM. And then you're like, what does that mean? And Iman, in your paper, you talk about the diagnostic odyssey for people with conditions. So could you tell us a bit more about this?
Hi everyone. So yeah, this wasn't something that I had really heard about before, the diagnostic odyssey, but I think it's quite a common term used for rare conditions, and it basically encompasses kind of the journey someone and their family and the people around them goes on from when they kind of first have those symptoms like the persistent ear infection, facial numbness, and they kind of go to their GP, and then where they end up next, and then oftentimes that might not be the right place. So in Charlotte's case, I guess it was because it was neurology. But for some people, most people, it isn't the right place, and they kind of end up getting discharged from that service and then go back to their GP. And there's a lot of like back and forth and uncertainty. And I want to make sure I get these numbers correct. But on average, this can take 5.6 years, so like 5.5 years for someone to reach the correct diagnosis. And throughout that time, you're seeing different healthcare professionals, different specialties, potentially different hospitals, over a region, things like that. And the other key thing, and sort of we spoke about this in the blog because it kind of tied in with Charlotte's experience of, like, is it maybe MS? Is it maybe the AVM? And I think at one point they were also thinking possibly myasthenia gravis. That there was a few different things, if I'm remembering correctly, Charlotte. But also during that journey, on average, people have 3 misdiagnoses. So yeah, it just kind of encompasses that ex experience, which is, I guess, unique to people with rare diseases as they try and like reach a diagnosis.
Now, I'm sure those who've joined us today who have Cavernoma or are a parent or supporter of someone who does, this is going to be resonating, because we hear this very commonly on our helpline, the challenges people get to getting an accurate diagnosis, which makes it all the harder not knowing what it is. So Charlotte, just going back to your story and the story that you shared with Iman for her essay, sadly, I know things took a bit of a turn for a worse after that. Do you mind telling us what happened next?
Yeah, so after that appointment, and I remember the neurologist saying then, like, just continue living your life, like you're like nothing is likely to happen. We'll see you back in a couple months after you talk to the surgeon. A month later, I spent about a week kind of going, I really don't feel right. I really look really dizzy. I remember one of my coworkers taking a crack that, oh, was I drinking on the job because I was so unsteady? Because my cavernoma was in my kind of cerebellum brainstem. And so it was affecting my balance. And so I was like, I really don't feel right. This isn't correct. And so then went to a GP who was by my university, unfortunately, not my own. But they were fantastic because I kind of said, well, I am seeing a neurologist at the moment. I don't feel right. Like, what do you think, basically? And the GP said, you look like you have vertigo, but since you're seeing a neurologist, please go to A&E. So I went on and got pretty swiftly admitted back because the nurses got a little bit too nervous watching me walking from my seat to the door, because of how wobbly I was. And then I think I talked to 4, 5, 6 different doctors, student doctors, various different people, and my neurologists and so on. And at that point, because they still thought it was an AVM, I remember one of the registrars going, I don't think it's a bleed. You'd be an awful lot worse, an awful lot quicker if it had been a bleed. So we're going to get a CT and keep you in overnight because you're not safe to go home, but it's probably not a bleed. Then I got my CT and surprise, surprise, it was a bleed. So I got admitted in to the hospital, to the neurology ward, and I spent a week, I think, just getting worse and worse and worse. So when I went into the hospital, balance wasn't great. I was a bit nauseous, but like I could still do most stuff. And kind of within a week, I had really bad double vision. I don't think I sat up for about 4 days because any movement of my head and like my eyes, I would just vomit. And I just really, really struggled with my balance, and like trying to read anything. Audiobooks were a lifesaver during that time, and like just listening to music as well. And so slowly got better. I think they talked to my surgeon, Easter Sunday of all days. And again, it's another one where like when Easter Sunday, you see not only the neurologist on call, your own neurologist, and know they've talked to your neurosurgeon, you're like, oh, I'm really not well. Like this isn't a good day. But I spent about a month in that hospital, slowly getting better before I got brought out to the rehab hospital. And was most of the time was just kind of spent relearning my balance and letting the double vision go back to normal. And I had my first neurosurgery appointment within that. So I saw the neurosurgeon, and the neurosurgeon was, obviously things aren't brilliant at the moment, but it's going to get better. And other than that, this is like your first kind of proper bleed from the cavernoma. And because of the location, they effectively said they wouldn't touch it with a 10-foot barge pole because it was too close to like incredibly important structures. And the only reason or the only time they would touch it is if I'd had several bleeds in a year and had been left pretty significantly like worse off after them in terms of like side effects and so on. So I went back, recovered, spent the summer getting back to normal, sat my final year exams, having missed them all, being in hospital, graduated with my class group, found Cavernoma Alliance, Cavernoma Ireland, met my first like people with cavernomas that December, which was great. Yeah. And that was that beginning.
Aw. And Charlotte, I know when we were talking about this before, you shared that because you'd been told potentially MS, then it was an AVM, and then you find out it was cavernoma. And I remember something you shared with me was actually you kind of discovered they weren't the best at telling you that it was cavernoma. Was that right?
Yeah, absolutely. I think it was mentioned to me in one of the, like when you're in hospital, like all the various different junior doctors just kind of stop in at various points. And they're like, oh, have you been told this? And I'm like, no. And so I was told at some point throughout all that they were fairly certain now that it was a cavernoma. But again, I wasn't given any explanation about what it was, and it was only through finding CAUK and Cavernoma Ireland that I really like actually found out what it was, and yeah, had to do my own looking into it.
And again, that's something that's not too uncommon, that it is Dr. Google who helps. And we're conscious there's amazing medical professionals out there, and what we're focusing here on is the challenges of that pathway for people with rare conditions. And Iman, just to bring you in there, so I mean, I'm conscious you can't comment on Charlotte's case, but how common is it around perhaps, when a diagnosis is finally reached upon, it's not always communicated in the best way to somebody?
Yeah, so I think it's interesting. I probably didn't know a lot about this until I was like writing the essay and trying to kind of put Charlotte's experience, I guess, in like the wider kind of broader experiences of people with a rare condition. And I think it's quite interesting because most of the stuff about uncertainty I found was more during the time when the clinician is also trying to establish what is the diagnosis here. And so they're uncertain about what's going on rather than knowing what the diagnosis is or feeling as confident as you can be about what the diagnosis is, but not actually communicating that in a good way. So I suppose with the first half, what I was reading about with uncertainty and things like that is that it's really common. I think medicine just has a lot of uncertainty in general, but also patients can tell when a clinician or when a healthcare professional, when a doctor is not sure, even if they don't say it, but actually kind of saying it, not in a way that, oh, I'm just not sure, and the conversation ends there and we don't go any, but in a more positive way, that's actually better than almost trying to put on like the sort of trying to maybe act like or that when you're not really sure. But in terms of kind of knowing the diagnosis, but it not being communicated well, I have read a bit about like that does happen just kind of like miscommunication, or I know in Charlotte's case, using a lot of medical jargon maybe when explaining things, and maybe not always having the most patient-friendly explanation and kind of adapting it to the person in front of you based on how much they want to know. Because I remember when speaking to Charlotte, she was saying, she likes to know quite a lot about what something is, but some people might not be like that and they would prefer a bit less information. Everyone's different, and just having that tailored approach. So I think it's common definitely when the clinician's uncertain. I would hope less common if they know the diagnosis, but I'm sure miscommunications, not explaining things clearly, and can still be tricky, especially when, like with Cavernoma, the management side of things is also really uncertain. So I guess the uncertainty doesn't just stop at the point you get a diagnosis, possibly.
And Iman, this is where it's so good. We have organisations like Medics for Rare Disease where they're advocating for those improvements around, really emphasising how important it is to keep patient-centred, to be confident in not necessarily always knowing at the beginning, and that explaining that. And Helen, I'm just going to put you on the spot briefly here. I mean, is this something that just just a couple of minutes, but is this something that resonates with you, what you're hearing, that you've seen this across many other conditions as well?
Yeah, absolutely. I think challenges with both uncertainty and with, instances where communication maybe isn't quite what we would aspire for it to be is something that we hear time and time again amongst people who've had experience of rare conditions. And I think one thing we really try to impress upon professionals is that it's definitely not about being an expert in every condition, because that would be completely unachievable. But it's about having, an appreciation of the common issues that people come up against, and understanding what the principles of good rare disease care are. So a lot of the times that's the same as what it would be for a patient with any other condition. So it's about being upfront about where you're at. It's about feeling comfortable to say when you don't know what's going on, which I think I can only speak to my own experience, but when you are quite used to being the one that's helping other people understand about their health and give advice, that can be quite uncomfortable and almost a new experience sometimes for some clinicians. So I think it's, like I say, just about being clear and helping everybody to understand that, we're not at the end goal yet, but we're continuing to work on getting you there together, and we'll keep you informed.
And Helen, it's great we've got Medics for Rare Disease advocating for that, because it's something we believe in very much here at Cavernoma Alliance UK as well. And so, Charlotte, coming back to you, so you'd been incredibly unwell, but then your symptoms had improved after your bleed. And can you tell us what happened next?
Yeah, so everything was finally, getting back to normal. I was taking a year out before I started a master's, and was just kind of working away locally. And then, so coming up to like the new year after Christmas, I was super overworked, having covered basically everyone's holiday shifts. And I spent again another probably about a week going, I mean, I'm not right, but I'm not bad enough to go talk to my GP. Like, I'm not as bad as I was the last time I had a bleed, so this can't be a bleed again. Like, it's only been not even 8, like just about 8 months. And I think there was a couple of things that week where I just was like, no, I should probably go talk to my GP. And I'm incredibly lucky that I've had the same GP since I was born. And he was very responsive when I went in, because I went in going, he's probably not even going to notice a difference. Like, I just feel not quite right. Like, I just look slightly off balance. But he was very good, took it all incredibly seriously, and got in contact with my neurologists and their team. And again, they said the same thing almost as they had the first time I'd gone in, where they went, the registrar I was talking to was going, you're due to be seen in a month by your surgeon and you're getting another scan then. So we probably won't scan you. You don't sound too bad, basically. Like, we'll probably leave it till then. But I got another phone call then, I'd say, I don't know, half an hour later or so, saying, actually, yeah, I talked to the consultant. Could you please come in and we want to get a scan done? Except it's Friday and our CT is closing in like 45 minutes. So can you get up here as quickly as possible? So went up, got that CT, and again, it was another bleed. So I'm brought into the same ward with all the same nurses, which it was lovely to see them all again. I didn't particularly want to see them so soon, but it was really nice to see them. You know, I got put in asked which room did I want, because my favorite room wasn't available. So would the one on the left be okay? And I then was moved kind of a day or two later up to my surgeon's hospital, because they're two different hospitals here. And went up there because my surgeon was wanted to do some more investigations, do a angiogram and some more MRIs and some other stuff, because they were kind of, you know, thought that it was a bit unusual that my cavernoma had bled so like close together and like to such an extent, that they really wanted to make sure that it actually was a cavernoma. Again, it got floated that maybe it could have been something else and have been misdiagnosed the first time. So I went back, had all of that, and then they had a couple of, what do they call them, like multidisciplinary discussions, and they talked through, and I got told on a Friday that I should maybe begin to consider surgery, you know, because my cavernoma had bled at this point. Based on the scans, they decided it had been 3 times in a year at that point. And I should really, you know, just have a think about it, because if there was any time, it was then that they should do surgery, like while I was in the hospital and while I just had a bleed. And so the Sunday, my consultant came in and had a proper sit-down discussion with me and my parents in the hospital room, and kind of, you know, he pulled out the pen and paper, drawed a nice diagram of exactly where my cavernoma was, what sort of things it would affect, how I could lose my ability to swallow entirely, like on the left side, but that I wouldn't be getting that back because of where my cavernoma was located, that any kind of damage I had was going to be permanent. So there was the like swallowing, that I could have had some kind of like facial like drooping palsy, I think. You know, my double vision would have got worse, and my balance would have probably gotten worse as well. And then, you know, there's always the like small chance of dying from the surgery, but really the big ones was the fact that he was kind of trying to hammer home that any side effects I had from the surgery, my brain wasn't going to be able to reroute itself around them. So I was going to have to live with them in effect. And then my mum asked the wonderful question of, well, you have done this before, haven't you? And my surgeon goes, well, you'll be my 3rd one. And I've never done a cavernoma removal where yours is. But, you know, I'm very experienced in epilepsy surgeries in that area in children. You know, I'm very familiar with the area. And as scary as it was to hear that, it almost made me feel better about it, because he was so candid and he explained exactly how the other 2 women, how the surgeries had gone for them and how they kind of were doing years on from the surgery. You know, one was delighted with it and the other one really hadn't been able to come to terms with the side effects they'd been left with. And so I was kind of like, well, it's almost 50-50.
Oh, and Charlotte, I think first of all, just to acknowledge, as you're saying that, I'm thinking, gosh, you were university age at a point in your life where everybody else would have been, you know, getting drunk, doing whatever they were doing, and to be given those choices. And I know certainly for me, I just want someone who like knows to tell me what to do. And there you are being presented very candidly with the risks. and effectively that being handed over to you to make that decision. That's a big decision. And Iman, I was just wondering, how common is this from the research you did for your essay? How common is it that that would be handed over to a patient to weigh up that uncertainty? As Charlotte said, 50-50. That's hard.
So I suppose I've not spent loads of time with surgeons, but from what I can see and kind of just understanding, I suppose, medical ethics broadly, is I think, it's when you're in a situation when you can tell someone like, oh, you don't need surgery right now, like that's easier to do. So that happened to Charlotte, I suppose, earlier on. But then at the point when it's that maybe you should have surgery, but there's a lot of risks associated with it. I guess it's really tricky, but I suppose the only person that can really make the final decision on that, because you have to weigh up the risks. And I suppose, like somebody might look at it and think the thing that stands out to them is the 5%. Oh, so it was about 5% risk of death. I think I wrote in but they weren't sure, but say like the risk of death, for example. But then for someone else, it might actually be more to do with the swallowing and like the facial palsy, because they feel like that's going to impact their quality of life. Like, people, it's very personal. Like, and I think there's a lot of like wider, probably like how you've been raised, like your family, the culture, maybe your religion. Like there might be loads of different factors that come into play when you make that decision. So I suppose it is tricky because it probably does um fall on the patient in terms of someone else can't make it for you. But I guess what would make things like more helpful, maybe like easier for the surgeon and then also for people with Cavernoma, is understanding a bit more kind of the success of like having surgery versus medical management. And I know that recently, well, I guess it was over the last few years, but fairly recently published the pilot for the kind like CARE study, thinking about how the feasibility of a randomized control trial, which would be like the gold standard trial, to actually compare the different managements of Cavernoma, and possibly if that was very successful. So if the funding and things work out for a international randomized controlled trial, maybe there'll be a greater understanding of weighing up between surgery versus medical management, and that might help make the decision possibly easier, because it will be less anecdotal, I suppose. Like Charlotte, you were dealing with quite anecdotal evidence. Like I've done two and it's like 50-50. What it just feels like, okay, 50-50. You can't really make much from that, but maybe something like a randomized control trial helps build that evidence base a bit more, and that might make this easier for clinicians, for patients, for families, possibly.
Oh, thank you so much, Iman. And I think that really highlights the importance of research for rare conditions, because at the moment with Cavernomas, we just don't have that research to say, is it better to leave the Cavernoma alone, or is it better to try surgery? That could be neurosurgery to resect the Cavernoma, remove it, or stereotactic radiosurgery, also known as gamma knife. And at Cavernoma Alliance UK, we've been working closely with Professor Rustem Al-Shahi Salman, who's been leading on that research to really try and get those answers. And we're very grateful to all the CAUK members who took part. So thank you. Thank you, Mum, for sharing that. So Charlotte, such a difficult decision. And I guess I'm wondering, what did you decide, and what helped you to take that decision with those 50-50, 50-50 odds?
Yeah, it was a huge decision. And like at the time I remember grappling with, I didn't feel that bad, because even though I was having a bleed, like, okay, some double vision was back. My balance wasn't amazing, but like I could still walk around. I didn't need crutches to balance myself. And like I could still like read a book, and I could do all these things without feeling incredibly nauseous and so on. And so part of it was me going, but I feel okay right now. I mean, obviously not amazing because I was in hospital having a bleed, but I didn't feel incredibly unwell, unlike the first time. Um, but I remember, and like some of the people I'd met in the rehab the time before, like I remember talking to one of my occupational therapists and her talking about how much when you're younger, your recovery is quite often an awful lot better because your brain is so much more plastic. And that was one of the things that for me weighed into the decision because I was like, okay, well, I would rather almost be going through this now, and especially because I had the time off, I wasn't in full-time education at that point. My only job, like I didn't have like a proper career to speak. I was doing like part-time work, before I was starting this master's. And so it was kind of a time and a place that it it suited almost, for lack of a better way. And I know I didn't have I wasn't really, it didn't feel like I was in a position to get a second opinion because I was in the hospital. And, when my surgeon was talking to me, he was like, if you agree, we can do surgery next Thursday. And I was like, well, that's 4 days away. And like so it was a really big decision. But what in the end I decided to do it, and what really helped me make that decision was I decided I never want to have to do recovery again and like go through rehab. Like, I had kind of decided that through almost blind optimism that no matter what the side effects were going to be, well, I was young, I was fairly fit because I spent every day mucking out like 50 boxes at the stables. So I was fairly fit and I had like the best chance of recovery if I did the surgery then. And I talked to a very good friend of mine who, highlighted the points that like Iman made of, to me, and I joke about it, but it's dark, of like, well, it's not going to affect me if I'm dead because I'm not the one who has to live with that then. Like, I just won't know, in the darkest like way possible. But what I struggled with more was the fact of like, okay, well, I could lose the ability to swallow, or have the facial paralysis, or really struggle with my balance again, and always need like mobility aids and so on. And having one of my best friends, her mum had gone through spinal surgery, and so being able to sit down and talk through all of this with them, like it was the best friend's mum who turned around and went, okay, well, what's the worst case scenario? And I said, well, I die. And she went, no, what's the worst case scenario to you? Like, what actually, like, couldn't you live with? And we sat down and talked about this, at which point I was just confident with my decision. And I think that's the thing you have to come back to is like, I was happy that that was the right choice for me at that time. And maybe I'd be saying something completely different if the surgery had gone really badly, but I've been incredibly lucky that my surgery went really well and my surgeon was able to remove all of it. I spent 2 weeks in my surgeon's hospital. I spent a month in my neurologist's hospital, and then I spent a month after that in the rehab, or not even a month because COVID happened. And so I got discharged early from the rehab hospital because they went, well, you can get up steps and you live in a bungalow, so you'll be fine. Was basically the guts of it. I'm sure there was more like the PT signed off on more than that, but that was basically it. They were like, you're well enough, you can go home and recover from there. Because after the surgery, my balance went bad again. I had to learn that again. In the beginning, I wasn't even trusted with the Zimmer frame because I would have just fallen over. I had to have a nurse holding each arm to help me walk. And luckily, I have a little bit of numbness on this side, but I can still eat all my food, drink everything that I probably shouldn't as well. And for all intents and purposes, have a pretty normal life. Like I've done the master's, I'm now doing a PhD. Like I've been incredibly lucky. And like one of the longest running side effects is I've ended up with a lot of nerve damage. on the whole right side, so I have nerve pain from that. And temperature is a bit weird. I don't really feel it on that side. But between that and my balance sometimes making me fall over, like, to me, that isn't a huge sacrifice for the fact that I now know my cavernoma is gone and I don't have to go through that surgery again or that recovery again.
And Charlotte, thank you so much for being so open and candid about that. I know people watching this will really appreciate that. And I know we'll probably have some people either watching live or going to watch this later on YouTube who may be where you were back at that time taking that decision. If there's maybe one or two things you would say to them, what would you, if you were able to talk to your former self, what would you, or talking to someone who's taken that decision for themselves, what would be your best advice to them about how to come about to that decision?
Yeah, if you have the time for it, like if you're not sat in a hospital as I was, try and get a second opinion. Talk to someone else. At the end of the day, you have to trust your surgeon and make the decision that for you feels right at that time, because either way, you have to live with the consequences. And so what really helped for me was being confident in my surgeon. Even though, as he said, he'd only done, I was the third one. Um, and just thinking about the situation that you're also finding yourself in. So for me, like I said, the timing of it was also quite opportunistic to a certain extent for me. Whereas, say, if I had, a million other things to think about, family, house, mortgage to pay, a job, that sort of thing, like, I don't know if I would have made the same decision. Maybe I would have because I had the support network around me. But I just don't know. There's so many other things that you have to think about as well.
Oh, and Charlotte, it's such a good point you made there about second opinions. I know on the helpline, people often feel nervous. They feel like they could be undermining their clinician. And something we always say to them, it's a rare condition. And clinicians do understand the request for a second opinion because often the clinician might have had very little experience. So they don't mind, and it's okay to ask for a second opinion. And I just want to read out a lovely comment here. Someone said, "You're incredibly brave and inspiring, Charlotte." And they've just asked where your cavernoma was in the brain, and the answer is yes, it was brainstem, wasn't it?
Yeah, cerebellum touching into my pons, so brainstem as well.
Yeah, no, but I thought it was a lovely comment. And you are to have gone through that, but also it's not easy talking about these things. So thank you ever so much. And Charlotte, just before we go on to Iman, I know you had some good news recently. Do you feel comfortable sharing that?
Oh yeah. So Tuesday was hopefully my last ever neurosurgical appointment. It's been nearly 5 years now since the surgery. And so I was told in the phone appointment on Tuesday that I didn't have to come back next year, which is nice. No more yearly MRIs.
Discharged. Wow. That's just amazing, Charlotte. And I know it will fill a lot of people on this call with hope. Wonderful. And so, Iman, I'm just going to ask you a last question before we open up to questions and answers. So just to say, if you've got a question for any of our panelists, including Helen, please do put them in the Q&A because we're going to come to that next. So Iman, for you, you're at the beginning of your career, fifth year medical student, interest in neurology. We'd love you to specialise in neurology and carry forward a passion for cavernoma. So when you were interviewing Charlotte for this essay, what were the takeaways for you, and how's that going to inform your clinical practice when hopefully you go on to become a neurologist?
Yeah, definitely neurology is like top of my kind of like ranking. Actually, as part of the essay competition, you could put what specialties you were interested in. And I did rank neurology first on that, so I was quite happy. When I got, even though I hadn't heard of cavernoma. So one big thing is that, and maybe this is a small win in the grand scheme of things, but I can tell you one more medical student knows what a cavernoma is. And I was in an additional lecture. I think I told Helen about this. I was in a kind of additional lecture I did outside of university because it was about stroke and I was interested just because it's neurology. And they didn't talk about it, but I just saw a bullet point of like different causes and it said Cavernoma, and I like took a photo of it. I was like, I see it. I know what a Cavernoma is now. So that's one big thing. I think it was just like it was a real privilege to sit with somebody and speak to them for a good few hours about and if you do it, you don't have to give up a good few hours. I think the conversation was just naturally flowing and we had a lot in common. But you never really in medical school sit with someone and really talk to them for that length of time and like actually try and unpick the whole um journey. And I think as like Charlotte, she's just so like such an open like person that I felt so able to ask certain questions, like sort of understanding like how did this affect like your family or your like mental health, and if you're the older sibling, how did it affect the like younger siblings and change that kind of family dynamic. And just that was just a real privilege to even just know one person's story in that much depth, and it encourages me to just pry like where appropriate, a bit further, and always remember to ask about like how is this affecting you. And if someone comes back and says, well, physically I've got this and I've got that, kind of following that up with, right, but like how is it affecting you like mentally, emotionally? I think that's really important. I know I don't want to get the statistics I say here wrong, but this from a 2018 study, actually 50% of people with rare conditions, their patients slash carers had never been asked about like mental health and like mental well-being. So definitely thinking holistically, that's a big thing. And another thing was, I guess, communicating around uncertainty and being being honest and like being sort of presenting uncertainty in a way, but like with confidence and with a kind of, but let's try and find this out together sort of attitude. I think that's important. I think you'll always have a bit of uncertainty, maybe even with non-rare conditions when you're just first trying to work out what's going on. So I think that's important. And then another thing, I think speaking to Charlotte and hearing about the value of Cavernoma Alliance and patient groups is definitely to always think about recommending a patient group, even if I come across a condition that I haven't, maybe I've not heard of it, but if I actually just, it's not that hard for me to just have a search and then maybe ask like, oh, have you heard about this patient group? Is that something you're interested in? Because another piece of reading I was doing was that a report found that 4 out of 5 people diagnosed with a rare condition did not have a patient group recommended to them. And I think that, and I'm sure a lot of those people maybe go on and do what Charlotte did and search up the condition and find it, but it would be really nice and kind of contribute to that overall like supportiveness if it can maybe be the clinician that actually maybe puts that forward or has even done the search for you and is like, oh, would you be interested in this? I can attach the link to your like letter or by text or depending on the technology of the hospital. So yeah, I think those are the key things.
Well, Iman, that's music to our ears. We'd love it if every clinician who diagnosed Cavernoma referred their patients to Cavernoma Alliance UK. And it's wonderful that you've become involved with us, and we're thrilled that you've also joined our advisory board. So both Iman and Charlotte on our advisory board. And we're really committed to ensuring that we have clinicians at a range of stages in their career. And I think it's really important to have your voice as someone starting out on that career. So thank you so much, Iman and Charlotte. That's been incredibly inspiring, thought-provoking. And I'm now going to open up to some questions. So if you haven't already, please put a question in the Q&A to our panelists. And I'm going to begin with the first question. And this is probably one for you, Charlotte, first, but then Helen and Iman, please also do chip in. So the person who's written to us has said, I'm in the position where I'm trying to decide whether I have surgery or wait and see. I have a cavernoma in the left frontal lobe, which bled last year, and I was diagnosed straight away. It's good to hear, actually, that diagnosis happened quicker than it did for you, Charlotte. The neurosurgeon has given me 3 options. neurosurgery to remove the cavernoma, gamma knife, or wait and see. I've decided not to go with gamma knife, but I'm unable to reach a decision. Everything just keeps whirling around, and I'm finding it impossible to assess the right criteria to make this decision. So, Charlotte, the question there is about criteria. What are the key things to keep in mind when making that really difficult decision as you did? So what would your advice be to this member who's struggling with that decision and how to make it?
Yeah, it's absolutely such a tough decision, and it's such a personal one as well. I think having, a support network around you for the recovery, because no matter how long they say it will take you to recover, it's going to take so much longer before you feel like yourself again, even after that. And so having a support network, whether that's family, friends, whoever, to help you with the surgery, I think is really important. And then also just thinking about, like, can you take the time for the surgery? Can you live with it if the surgery were to leave you with worse side effects? Like, what would be your thoughts, like, each way or either direction? And then it's just, yeah, having confidence in your doctor or your surgeon, and being able to ask them questions or get a second opinion if you want. Yeah.
Thank you, Charlotte. Imam, Helen, is there anything you'd like to add to that about that criteria for taking that decision on surgery or wait and see? That's all right, Imam, Helen. Oh, Helen, you're on mute, sorry.
Yeah, I was just asking Iman who wanted to go first, but maybe I'll press on. Liz, thanks for your question. I'm sorry that you're in a position where you have to make what is obviously a very difficult decision. I just want to caveat this by saying that this isn't medical advice. I don't practice clinically anymore, but in general terms, what might be an idea is for you to take some time, something I always recommend to people, given that medical appointments can be quite overwhelming, quite stressful, sometimes you can feel quite rushed, is before the next time you see your surgeon, maybe have a think about everything that comes into your mind, write it all down and see if you can come up with a list of questions. What are the key things that you want to try and find out answers to? So as we've heard, it may well be the case that your surgeon can't answer everything, but even to have the opportunity to explore those things and bounce ideas off somebody that does at least have expertise in neurosurgery, if not in cavernoma specifically, that might be of some value. And I think, your predicament highlights in the same way that Charlotte's does how difficult it can be to make an informed autonomous choice when we don't have as much evidence as we would like. And so hopefully that will change in the not too distant future. But thank you so much for your question.
And Imam, is there anything you'd like to add to that, or are you okay?
I guess it sort of echoes what's been said, but I wonder if how Charlotte had the friend's mum that she could speak to, sort of like a similar experience, but not exactly the same, and maybe close, but like a little bit distant, like someone like that you can speak to. Like maybe it's hard when it's someone that's really, directly close with you, but maybe if there's things you want to talk through, I don't know if it helps. It helped Charlotte, I suppose. So maybe kind of identifying someone like that, or I don't know if that's possible through like Cavernoma Alliance, or yeah, maybe something like that. It's very tricky.
Well, thank you so much, Charlotte, Helen, and Imam. And what I've put into the chat is we've got a web page on questions to ask. We've got your doctor, neurologist, and at the bottom's neurosurgeon. And also to the member who posed that question, to make you aware that our charity does offer counselling. Sometimes having that space to chat things through with a counsellor can be helpful, and we offer 4 fully funded sessions, or you can have 8 part-funded sessions. And we also offer Cavern buddying, where we buddy you with somebody who understands what you're going through and can give you that space. So I'll add the links to the counselling and the Cavern buddying in a minute. And just to read some of the comments before I go to the next question. Barbara says, thank you so much to you both, Charlotte and Iman, for sharing your story. Inspiring and good to know the learning is shared in the medical community and wider. Thank you everyone on the call for joining us tonight. And Heather says, Charlotte and Iman, just a huge thank you for sharing your perspectives. A real privilege to have you both supporting CAUK. Some lovely comments. So I'm just going to go on to the next question. And if anyone has any more, please do let us know. This is the last one I've got so far. So if I don't get any more, we'll be bringing the webinar to an end after this one. So this one's addressed to Iman. Iman, firstly, many congratulations on your essay. How do you think it's best to share knowledge of rare conditions with medical students?
Thank you. Yeah, it's tricky because there's so many. I think there's around 7,000, but I know Medics for Rare Diseases, they have a Rare Disease 101. Helen, forgive me if that is incorrect. Right, yeah, that is correct. A Rare Disease 101 course. So it's got like maybe like 8 sessions where you can work through things around rare diseases. And also there was recently some work and it was kind of like the red flags of rare diseases and picking up those things like the kind of hints that this might be something rare going on. So I suppose broadly there's that, but I have thought about this quite a lot because I've noticed, so when I do question banks in like preparation for my medical school exams, and these are like question banks that everybody uses, like past medicine, or Helen probably use them as well. It's for everyone, it's universal across people from different medical schools. But there are some rare conditions that pop up quite commonly. So like myasthenia gravis is a really common exam question. And so I know a fair bit about that. And then I wonder if, okay, if there were maybe some questions on some other rare conditions, maybe that would be one way. I know a lot of people's learning does come from question banks. So it does make me think, because I wonder, like, I don't know if with myasthenia gravis there's some certain features that make it quite a good question, quite like distinct things with like eyelid drooping at the end of the day, quite like textbook things. I wonder if that's why, whereas maybe with Cavernoma it might be trickier to do because it's got different presentations depending on the location and things like that. But yeah, I've thought about it a lot and I've not really been able to think what's the best way, because I don't think saying learn these 7,000 conditions is probably the best way. Potentially that might be a bit overwhelming, but at least being more confident around the uncertainty and kind of more the communication things, and being holistic, but not in like a sort of tick box way. For example, in the exams, always saying, oh, let me offer you a leaflet. No, actually understanding why you might offer someone support of a patient group, and understanding the value of these things might help you better support people with rare conditions. I don't know if it would necessarily make you better at recognizing rare conditions. I guess we can hope that maybe someone that's interested in neurology, they might uncover rare conditions maybe more in that area, and then people that are interested in other specialties might, through their own natural, I don't know, inquisitive nature. But yeah, it's really tricky. I don't think I have an answer on what's the best way, rather than just increasing a general understanding of just thinking that someone could have a rare condition, sort of adding that to your list of potential diagnosis, like thinking, could it be this, or could it be rare? I know a lot of people don't like for rare conditions to get like grouped together because that can be unhelpful. So it's tricky. Yeah, I don't know anyone else's thoughts.
Well, I'm just going to come to Helen if she wants to add anything, and then I've had just a couple more questions pop in. So Helen, if you just want to briefly, anything else you'd add, and then I'll just go to the couple of other questions we've had.
Yeah, absolutely. And thank you so much, Iman, for leading on that answer and giving a nice little plug for Rare Disease 101, because that is an excellent way for current medical students to begin to understand everything that comes along with being diagnosed with a rare disease. It's an e-learning module that we have on our for RD Learn platform. More broadly than that, though, I think what we have come to realize at Medics for Rare Diseases from our sort of grassroots evidence gathering is that actually medical students and doctors, broadly speaking, actually are quite interested in learning about rare conditions, and they find it valuable and applicable to their clinical practice. What I don't think that we've seen yet, to make quite a broad statement, is that buy-in from institutions in the same way. So I think in the long term, what we really need to see is, a greater emphasis placed on rare disease content within medical curricula. And that's something that we're interested in, pursuing as an organization. In the meantime, I think one of our key aims really is to get medical students to dare to think rare. So that doesn't mean that you need to know absolutely what's going on. It doesn't mean that every time it's going to be a rare condition, of course not. But just to be able to have that pause and think, okay, I don't really know what's going on here. That doesn't necessarily mean that, for example, it's manifestation of mental health problem or whatever it might be, just to consider whether it could be a rare condition that you're presented with.
Thank you so much, Helen. I mean, it's just wonderful to have you join in the webinar and to have Medics for Rare Disease advocating for people with rare conditions with all your great ideas. And it all sounds excellent. Thank you. So we've just got 2 questions which I'm going to take. So the first one is from someone who's joined the call saying, I've recently been diagnosed with a cavernoma. I had facial palsy, vasovagal fainting, apologies, but if I mispronounce, trigeminal neuralgia as a child, teenager. Is it likely these stem from my cavernoma? So just to that member, as we don't have a clinician on the call who specialises in cavernoma, we won't be able to give advice on that. What we would say on our helpline, and that's drawing from our lived experience, is that the location of the cavernoma will determine the type of symptoms a person has. And what I'm going to put in the chat is our booklet on symptomatic cavernoma. And in that booklet, if you scroll down, you're going to see an image of the brain. And each section of the brain, you're going to see the type of symptoms that are commonly experienced depending on where the cavernoma is located. So that can give you some additional information. And I'd encourage you to go back to your clinician and pose that question to them, because that's a really important one, to understand your history and as a child as to what that cause was. So let me just pop that in the chat now, the link to our booklet on symptomatic cavernoma. And the next question we've had is, hi all, thank you for this webinar tonight. It's been really helpful and interesting, so thank you very much to our panelists. When we're looking for a second opinion, do you have any recommendations for how to research specialists? So again, this is a question we often get asked on the helpline, who are the cavernoma specialists? I mean, you can get a good sense of that through looking through our social media thread and our YouTube channel. If we've got somebody talking about cavernoma, there will be somebody who's got a lot of experience in that. But we're mindful we don't currently have listed cavernoma centres. And that is actually something as a charity we're really interested in exploring. And we're having an active conversation with our advisory board about how do we go about identifying those and then telling our members. So just to let you know, we are discussing that and we'll update you in the new year. In the meantime, where we recommend you start is the Brain and Spine Foundation have a really helpful tool. And it's called Find a Neurological Service. And if you go on there, and I've put it in the chat, you can pop in your postcode and you can see all the centres of expertise for neurology in your local area. And that can be a really good starting point for thinking about a second opinion. So everybody, we have come to the end of tonight's webinar. I just want to say a massive thank you to our speakers, Iman, Charlotte, Helen. I love doing these webinars because I always learn so much from it. And just from the comments today, it's clearly been incredibly well received by those who joined. Say good night to you all. Thank you ever so much. And a very special thank you to Charlotte for being so open and honest and candid in sharing your experience. I know people have valued it. Good night, everybody. Take care. Bye-bye.